you know that being overweight or obese is bad for your heart. And imagine you've tried everything to lose weight, diets, exercise, even some fat programs, but nothing has worked. And the scale stays stuck, your energy is low, and your heart health is on the line. Then a breakthrough comes along, and suddenly the impossible becomes possible. Hello friends, I'm Dr. T, board-certified cardiologist and a passionate advocate for lifestyle medicine. Today we are diving into an incredible health story, a story of transformation powered by science. We are talking about Ozempic, a medication not just helping people lose weight, but reduce the risk of heart attacks and strokes. This is more than weight loss. It's about protecting your heart and reclaiming your health. What is Ozempic? It's a groundbreaking medication. It was approved by the Food and Drug Administration in 2017 to manage type 2 diabetes. But it didn't take long for doctors to catch on a fascinating side effect. Patients were losing weight. This discovery led to further research, and now Ozempic and its higher dose sibling Wegovy have created a revolution the way we treat obesity and cardiovascular risks. Both medications contain semaglutide, a compound that mimics a natural hormone in your body called GLP-1, glucagon-like peptide 1. This hormone sends signals to your pancreas to increase insulin and bring down your blood sugar. And it sends signals to your gut to decrease motility and slow down digestion, and to your brain to reduce hunger. Essentially, it helps you eat less and feel full longer. By 2020, Ozempic was approved to lower your risk of heart disease in people with diabetes. By 2021, Wegovy gained approval to use in case of obesity or overweight, even in patients who didn't have diabetes. How does Ozempic work? In response to a meal, the gut releases a hormone called GLP-1. So what's the magic behind Ozempic? When semaglutide is injected, it kicks into gear just like a GLP-1, and it triggers multiple systems in your body. In your pancreas, it goes to your pancreas, improves insulin sensitivity and reduces glucagon, helping manage your blood sugar. In your brain, suppresses appetite and thirst by targeting the area called the hypothalamus. And in your gut, slows down digestion, meaning smaller portions keep you full longer. And imagine having a heart-healthy breakfast, let's say steel-cut oats or omelet. Instead of digesting within an hour or so, the meal helps you feel satisfied well into the day, naturally reducing your caloric intake. This is why Ozempic is such a powerful tool for weight loss. How to use Ozempic safely? Ozempic is straightforward to use. It's a once-a-week injection into your abdomen or into your thighs or into your upper arms. And your doctor will start in a low dose, usually 0.25 milligrams, and if you are not having side effects, in 4 weeks we will increase the dose. We'll keep increasing every 4 weeks until you obtain the desired level. How effective is Ozempic in weight loss? In the clinical trials, semaglutide showed a remarkable results, obtaining what we call a clinically significant weight loss. That means at least 5% of your body weight. Patients lost on average 15% of their body weight, and in some cases nearly 1/3 of participants lost 20%, results comparable to bariatric surgery. And the weight loss isn't merely cosmetic, it has profound implications for your heart. Obesity is a major contributor to high blood pressure, to high cholesterol, and high triglycerides and inflammation, all of which increases the risk of heart attacks and strokes. And symptoms of obesity and heart disease are intertwined: shortness of breath, fatigue, exercise intolerance. And addressing obesity, you're addressing these symptoms as well. And we know now, for instance, that for every kilogram, 2.2 pounds of weight loss, you lower your systolic blood pressure by 1 millimeter of mercury. So you have to work with your doctor, because your medication doses may have to be decreased. In some cases, you may even be able to get off some of your medication. Who should take Ozempic? Who is the ideal patient? Obviously, people who have type 2 diabetes, lowers their blood sugar and reduces the risk of serious heart problems. And for weight loss, it's recommended for adults with a BMI of 30 or higher, or those with a BMI of 27 who have an obesity-related condition like high blood pressure or high cholesterol or high triglycerides. And for cardiovascular protection, studies show it reduces the risk of heart attacks and strokes even in people without diabetes. And yes, Hollywood celebrities rave about it, but Ozempic isn't just for vanity. It's a tool for real health transformation. And remember, Ozempic works best when combined with lifestyle changes like a healthy diet and a regular exercise. Let's dive into heart health benefits. Here, the real game changer, Ozempic, doesn't just treat obesity, it protects your heart. It's in a trial called SUSTAIN-6 trial. Semaglutide reduced the risk of major cardiovascular events, heart attacks and strokes and cardiovascular mortality by 26% in patients with diabetes. And the benefits don't stop here. Just a newer study published last year in 2023 showed Ozempic improved symptoms in patients with congestive heart failure and preserved ejection fraction, decreasing their shortness of breath, improving their exercise tolerance, improving their quality of life. And here's why this is a groundbreaking. For the first time in history, we have a medication that tackles obesity while simultaneously reducing the risks of cardiovascular death. This is monumental, especially in a world where nearly 40% of adults in the US struggle with obesity. So is Ozempic a magic bullet for weight loss? Well, there is no such thing as one-size-fits-all solution. Ozempic is as close as it gets for many people. It helps you lose a significant amount of weight, reduces your risk of heart attacks and strokes, and improves the overall quality of life. But here's the key. Ozempic works best when paired with lifestyle changes. And if you're ready to take control of your health, start making small, sustainable changes to your diet and exercise routine. We recommend minimum 150 weeks of some aerobic exercise week. If you like this video, share with your family and friends. And if you want to learn more about ways to lower your cardiovascular risk, even with no medications, watch this video. Can exercise lower your risk of a heart attack? I'll put a link above and in the description below. And always remember, your health, your most important asset. Take control. See you next video.